Thank you, Madam Speaker. I rise today to recognize nurses during National Nurses Week. I have had the great privilege to work with some of the greatest nurses in my 26-year career, work closely with all kinds of nurses and all kinds of specialties, CRNAs, certified registered nurse anesthetists, nurse practitioners, and the person I love the most is also a nurse who works and she's here with me today, my wife, and she's a nurse at the Pregnancy Care Center. But nurses are amazing, dedicated professionals. When I graduated medical school in 1997, it was like one of those war movies where you see the fresh-faced lieutenant comes out of officers training school and he's in charge of a unit with the grizzled, battle-scarred sergeant. That's what it's like as an intern working with some of these nurses. They know what's going on and you have no idea, but your goal is to earn the respect and the trust of your sergeant, of the nurse you work with. And really the pinnacle of your profession as a doctor is when you can earn the trust and respect of nurses you work with, that they would trust you with their mom or their kid or with their own lives. And so that's really the thing that you work for the most. You want them to rely on you and you rely on them. I cannot tell you the amount of times nurses have saved me. And so many times you would think I was a bad doctor, but they have saved my career so many times. So whether it be they see a patient that's sick and they say, hey, you got to go into room 3 right away. This is somebody you need to see right away. And you do. You go into that room right away because if a nurse tells you that this is a sick patient, that's your priority. They've been able to work. We've worked OR codes together like a synchronized machine. You don't want a bunch of doctors working on a code because they don't know where anything is or how to do anything. You want nurses working with you. I've worked through the night many times. Nurses are on call just like physicians, and we've worked through the night innumerable times. They've been able to dive deeper into problems and see things that a home situation or a social situation that I had no idea because I didn't have the time or really the skills to get deeper into something. They have incredible instincts. And an example of that is I remember when we had a sick kid and had a virus, and my wife was saying, she's a nurse, as I said, she was saying, there's something else going on, as our 5-year-old boy at the time. And I said, no, he's fine. I just counted it. And I woke up at 3 in the morning with my wife getting dressed and dressing my son, and she said, I'm taking your son into your emergency department because there's something going on. So I was shamed into taking him, and sure enough, he had meningitis. But she had the instincts, not only of a mother, but of a nurse, to recognize there was something else going on. And I had to make the call of shame and tell her that she was right, and there was meningitis, and our kid was getting admitted. But to end, I just want to remember who were the true heroes of COVID, of the pandemic. You could go into our ICU and look down the hallway, and there was doctors, attendings, residents, medical students around computers, looking into the ICUs, making orders, and every room had a nurse in PPE at the bedside of every patient. They are the true heroes of the pandemic, and when our loved ones were dying alone, they were the ones who held the hands of a dying patient when we could not be in there because of COVID. And with the greatest care and love, they made contact and they held the hands of our dying loved ones. So it is a special profession, and it's a small thing, but it's with heartfelt gratitude, patients, doctors, hospital staff, the people of Illinois and this General Assembly say thank you and happy Nurses Week. Thank you, Madam Speaker.